Reimagining Campus Community, Dr. Oscar McKnight and David Ross. I think we were looking at some of the other presentations, and we think ours might be just a slightly different in some way. So this will make sense. I want to do a little bit more of an intro, and then we'll jump into some of the slides. So I'm trained as a counselor. I'm a clinical counselor here in Ohio, and I did direct clinical work for about 10 years, and then worked now the director of the Mental Health and Recovery Board in Ashland County. And this is important. Ashland County is 52,000 people, so small, rural, just up 71. Grandpa's Cheese Barn. Anybody go to Grandpa's? Okay, good. So that's us. That's Ashland County. But a relatively small county. And I think as we go through the presentation, we're hoping that you may glean some ideas from what we say. But yes, these were raised in a particular environment of Ashland County. They may or may not apply to your situation, or maybe they apply in a slightly different way. So I've been the director of the Mental Health Board and working there a total of 19 years. In about 16 or 17 of those 19 years, a relationship formed with Dr. McKnight at the college, Ashland University. And that relationship is basically once a month. We have met for coffee at a variety of locales over the years, and we've kept each other informed. Oscar keeping me informed on what's going on the campus, and me keeping Oscar informed about what's going on in the community, particularly as it regards community substance use and mental health services. And that's the heart of what we're talking about, and I think what we're trying to get at, we've heard this in several of the presentations, it's about partnerships, collaboration, and unless you have that with a sufficient capacity of your campus and your community, I don't know how far you're going to get with whatever the initiative is, all right? And the other thing, you probably figured this out, is time, all right? Oscar and I have been at the same two people for 17 years. If you're in a situation where there's constant turnover or people are coming and going, it's really hard to form that kind of relationship. So I get there's a lot of challenges with making some of these campus and community partnerships work. But so I've been, I like to call myself a bureaucrat because that's what mental health and recovery boards are. And if you don't know what a mental health and recovery board is, we receive federal, state, and local levy funds to purchase through certified providers mental health and substance use services. So taxpayer dollars. So our board, which we have an 18-member board, ultimately makes the decisions. They hire an executive director, and they allow me to hire a small staff. Dr. Ashley Ackerman is one of my staff. Happy that she could make it down here. So it's our providers that do the work, but boards are in the position to really understand what's going on in the community and try to sort out what the needs are and what's the best way to meet those needs and who can do that. So it's a great, Ohio's system of county boards is kind of unique. I'm obviously biased. I think it's a wonderful system because it does allow subsidiarity, a big word that just means folks that are closest to the issue typically know what's best maybe for how to solve that, okay? So I'm biased though. So, if you go to some states, they have more of a regional approach or even a centralized approach. But you often hear folks in Ashland County say, what's Columbus know about what's best for what's going on in Ashland County? And I tend to agree more often than not. Some of the ideas that are coming out of Columbus lately, they're not good fits. So part of what Ashley and to some extent Oscar and I do is try to square pegs round holes. How can we make this work? We don't want to say no to the funds, but we got to make it work for what's going on in our county. I did want Oscar, if you want to do a little intro.
I'm Oscar. So I'm the director of counseling services at the university, psychological services, and of the health center as well. And I also title of associate dean, which you get a lot of titles when you're at a small school. But my life before the university, I worked at a drug and alcohol clinic, worked at a psychiatric hospital, community mental health. I did my tour of duty, all right, before I went to the university. But that's also why this partnership is really important, because I came from the community side. And I could tell you, at least in the community I was in back there, the different communities, there was no association with the universities. In fact, it was adversarial, to say the best, at best. So anyway, I always believed in, I never understood why in the world they were so apart or separated. So when I got to the university, I made every effort in the world to join them all together. And you'll hear a lot about Ashland County. And Ashland County is very unique and special, and it's small. And I'll tell you about the programs we've done over the years, but that's where I'm coming from.
Yep. All the fun graphics were Oscar. So that was a nice, fun town partnership graphic.
Well, I wish I could have drawn this, but I didn't draw it. But I did find it. My point was, which David did not understand. My point was that you see they're both holding on to each other. If one leaves go, the other, it's all over, right?
I said, why would somebody do such a thing?
And I said, I'm from Youngstown. It's sound all the time. Right? So, and I'm just saying that there's a balancing act. And I really don't like, I like it what it represents, but typically one person will let go and the other one fall, or they both fall. And I don't think this is I don't think this is really how you want your town-gown partnerships to go.
Yeah. And then if that wasn't enough,
yeah,
we have a Mobius model thrown in.
David hated this too, by the way. He didn't understand it. He just went round and round, put him right into a trance.
Right.
But my thing is that they should be seamless. The relationship between the mental health board or services, mental health services, and the university should be seamless. They should be just go round and round and round. There should be no stops. There should be a partnership or relationships, which David will talk about, that just constantly feed off of each other. And that's the reason for that Mobius strip.
So I know it's a lot to try to cover in about 50 minutes. So we're going to try to hit. Some of you have heard QPR, question, persuade, refer. That is a suicide prevention model we've been using on campus for about 10 years now, and it's been very successful at a bunch of different levels. We also do twice a year, some tabletop plannings that involve the community and the campus to make sure that we're constantly training to make sure we're responding in a way and everybody's coordinating and communicating to each other.
Yeah, before you go, the QPR training too at our university, that was not easy to institute, by the way, just to get it in there. And David does 80% of all the training. But now when he comes on campus, and everybody asks for it now he has all sorts of requests for the QPR training. Faculty does it, our administrators do it. He trains all our RAs, the athletics program.
The coaches, that was great.
The coaches program in addition to the athletes. So it's across the board. We've incorporated in the whole not just one group gets it. We have separate presentations for every group. So and most of those are David.
Yeah. And again, throw out, because it's Oscar's idea on the coaches and the trainers, they spend so much time with the student athletes. QPR is a wonderful fit. They may be the person that picks up on those changes most quickly. And as you might imagine, I mean, not to get into the QPR stuff, but an injury, something that maybe affects your scholarship. I mean, these can be devastating kinds of circumstances that for some folks might really put them at risk.
Yeah. Hey, somebody mentioned about the ACEs study. Was that yours? Somebody did earlier. One of the things, the ACEs study. Just throw this out there just so people know. We see athletes. We have a lot of athletes. We see a lot of athletes. For 5 years, every athlete that came through that took the ACEs survey took it, right? In addition to our general student population. And again, I always say I was going to publish this stuff, but I never did. But athletes have 5 times the score than a non-athlete. So if you think athletes have some sort of privileged life coming up, look at the ACEs scores, give those to your athletes and see what happens. Anyway, I just throw that out there.
Yep. So we're going to talk about a couple apps that Oscar and I worked on to develop, one that was specific to the campus and then one for the broader community. We're pretty happy with those. Collaboration with our community behavioral health agencies. I think AU is very similar to other campuses where they don't have the breadth or the robustness in behavioral health services, so they have to partner to get those behavioral health needs in the surrounding communities. Recent addition in the last few years was the on-site rape crisis domestic violence services on campus, and I think that's been well received.
Well.
And then we want to talk a little bit towards the end. I hope we have time. It tends to be the more controversial part of the talk, just what we're seeing emerging in terms of trends. And you mentioned the pandemic earlier, and we're not coming back from that. I mean, things have changed such that people have seen, are looking at behavioral health just like a lot of things differently. And I think, and again, he doesn't like when I say this, but Oscar's always been cutting edge with this. He's always, I think, being around the young people so much helps with that, but to think differently about how we can use, Oscar was doing telehealth before most folks were doing telehealth. He was using text messaging and calling and and he's got a drop-in thing that hopefully the clinic we can talk about. So very, very interesting ways that we can go about the work. And I think the pandemic has just opened a lot more eyes and made it maybe a little bit more acceptable to do that. This is another one of your fancy things that just talks about what we're doing the most of. Is this what you're trying to get at, Oscar?
Yeah, every one of these things involved the community somehow, the university and the community. From our crisis intervention is outsourced to the local community mental health center. They have the licensed screener. So anytime they do crisis intervention, suicidal intervention, we stabilize, they've come up and do the evaluation. All the mental health screening, same thing. Like David talked about, we have a suicide tabletop exercise, and that is, I don't know, we have slides on that later on? I don't know. Well, anyway, the bottom line with that is everybody in the community is involved with that. We have our fire department, our police department, the mental health agencies, Department of Health. We have, I mean, it's everybody. The mayor is there. All right, so everybody's on the same table. So when we run these suicide tabletop sort of exercises, everybody's there. Everybody has a plan. We go through what we're going to do, how to improve it, and they're done twice a year. So anyway, that's it. And then we have overflow community contracts with the university, for instance. I say that because our community provider is Appleseed, and so anytime we get overrun, we have a sort of a floating contract with them that they will see our students as well. Even without pay sometimes. They're really good. Anyway, we have, and for our businesses, our business community in the community, we give business vouchers or gift vouchers to our students to go buy things, all right, which again makes the community, makes the business, makes the Chamber of Commerce and all them really happy to be involved with us. So this is just showing you all the different things that we do, the educational workshops. A lot of the presenters there are from the community, giving workshops at the university, and we do vice versa. We go back and forth. So that's just all the things that we're tied into in general.
Yeah, you're right. This is the tabletop slide. This, I think, captures maybe some of the audience for that, and it is, as Oscar said, pretty diverse. And that's one of I don't know. I've worked in medium and larger counties, and you don't always see this level of involvement. That is one of the Mayberry-like things about Ashland County is I have frequent meetings, with the chief, with, the judge, with the mayor, with the county commissioners. So when you get that kind of access, some of these ideas can get into the implementation and action phases fairly quickly. So that is just a shout out for the smaller counties. There's tends to be less bureaucracy, I found. So QPR, real quick, 3 steps anybody can learn. If you're not, there's other models, but if you're not looking into this, we strongly encourage this for our campuses because I think it was already mentioned, it continues to be in the paper. Ohio, as you saw, just released, I think, 2021 suicide rates are back up after 2 years of decline. For the typical college age population, it continues to be the second leading cause of death, suicide. So that's one of the reasons we were able to get some buy-in, I think, so easily, maybe, Oscar, with the campus was that they were looking at the same stats as we are. So I don't want to overtalk. I mean, we obviously can talk a lot about QPR, but RAs, like Oscar said, coaches, once you start to do it and hopefully get good feedback from the folks that have been trained and they talk to other people and you get just 1 or 2 folks buying in at Oscar's level, it just becomes a thing. It's really not, as he said, it's not a hard sell anymore to get over there and to do faculty, staff, coaches, RAs, whoever wants it.
And I think everybody knows in this, what we talked about, it was brought up earlier, the population is changing. There's more of our students coming in with a history of some sort of mental illness or condition. Or, in fact, I was talking to David, we've been talking about this, that we have, I forget, we're totaling up all our stats for the end of the year. 25% of our students or something like that, a little over 25%, started medication when they were in 3rd grade. 3rd grade, 25%. And again, about the population, this year here at our school, we're a small school. We've had 16 hospitalizations. All right. We have nine of our students, and again, it sounds like small numbers, but 9 of our students are on pre-care, aftercare programs. Or we have 6 in partial hospitalizations. And then I don't even know the number. I have to look at how many of our students that come in we're on wraparound treatment plans, which again, we're a small liberal arts college, so they're coming in from all around the country. So I get these treatment plans from New York and Chicago, all over the place, and we do continuation of care. So to me, when we saw this conference, I'm thinking it makes absolute sense to be involved with the community because they're coming to us and not to have contact back and forth doesn't make any sense to me. So even, and I don't even really, the amount of students we have on continuation of care treatments or wraparound treatment plans, I don't know, it's got to be maybe 45% of our population.
Trying. Okay. So apps on a mission, we call it. So the two apps, how they came about, and we want to at least play one little short video clip here in a few slides so you can get a sense of it. You know, Oscar sometimes uses the idea, you know, not everybody's going to use the app, but there is kind of an expectation, almost like with a website, that you have one, that it's available. Even if you don't use it, you got it in case you need it. So we also noticed that folks wanted something readily available 24/7. And we're going to go through a little of those 4 points here in the next few slides. So readily available, accurate, useful, confidential, and private. And that's an interesting distinction for the younger generation, confidential and private. It's one thing to go to an agency and have a confidential counseling session. It's another thing to be able to stay in your room and have a session that's private and nobody else knows about, as well as being confidential. So there seems to be, at least among some of us at all ages, that privacy, and that telehealth for a lot of folks has been preferred. Again, small town, right? So a lot of folks that maybe are prestigious positions maybe go outside the county to get some of those services. Stigma still exists to some extent, right? So anyway, we thought, again, having an app, it's a very private way to get needs met and information. And as I said, there tends to be an expectation anymore that mental health and recovery boards, agencies, I think campuses have apps. So 2023, as you say, expected a digital presence, right? Even if they didn't use it, they want to know it's available.
They want to know. There's a couple things that, you know, gets back to your presentation on stigma. You talk about that. In our field, we always talk about confidentiality. Then years ago, all of a sudden, students started telling us, I don't care about confidentiality. I want privacy. I don't want people to see me coming in there. I don't want to be known coming in there. Confidentiality, they could care less. But the privacy part has come up more and more and more every year. And now that we have, at our school, which is very strange to me, again, we see over 600 students a year. And over half now, we give them an option if they want to be online or in person. And we have over half of our clients are online. And next year, we already asked who wants to, you know, we're doing all the surveying now about for next year's scheduling, and we're well over half already are coming back. And these are people who are transitioning in too, coming in. So anyway, there's a lot of things are changing. Yeah. Yeah. On this here about what they expect. What I wanted to say about the app, and I think we're going to talk a little bit about the app, was we surveyed, when we did these, when we made the apps, we thought, and the apps are pretty cool, we'll talk about the different apps, but one thing about the expectations, when we first did this, we were expecting a lot of people to use the apps, all right? That was sort of the expectation. You build an app, they're going to use it. I don't think we've ever had more than...
It's like a PSA.
Yeah, like a PSA. We've never had more than maybe 15% at any one time using the app. But here's the thing, though. We survey all our students every year and ask them what they like, what they don't like, what should we keep, what should we get away, you know, eliminate. When we ask about the app, we have never had less than 87% say, keep the app, we want the app. We have less than 20% use it, almost going on 90% say, yes, we have to have an app. So just knowing that it's out there has some sort of therapeutic value. So anyway, I wanted to throw that out there.
Yep. So again, this is my slide here to plug the relationships and partnerships, as I'm sure some of you already have these. But if you don't, just maybe some things that might make some sense to you to keep in mind. They are intentional. They do take time, right? So these things just don't happen. You know, Oscar's a really easy guy to get along with. So, you know, it was kind of easy once we met and got to talk. We have very similar frames. So you need a couple people from the community and at the campus, or even two. You can do it even with, I think, as low as two, if it's the right two. And there's got to be a degree of trust. Oscar and I share information about community and campus. You know, sometimes those conversations are difficult. I mean, people are getting laid off. Agencies are going under or changing direction. different things are happening. So there has to be, I think, a degree of trust between the parties involved as you're forming these campus and community relationships. Obviously, some shared interest. And what we like to do at a lot of our coffee meetings is to kind of figure out where we're going this year. What are those shared interests? And so much of this is driven, and that's why it's so fun to work with Oscar, because he's got these new incoming classes. Things are changing. Things are changing all the time. You know, I'm sitting behind a desk most of the day. You know, I facilitate meetings. I'm in meetings. I'm putting together agendas. It's kind of boring, actually. I need to do something different. But Oscar's seeing all the new trends constantly, and then we together can figure out, you know, how do we go about maybe solving this? We can't solve some of these new emerging needs the same way, I think. And that's been exciting, actually, to figure out what's the best way to do this.
Yeah, and I'll just build on what, the whole thing about relationships. It's all, for me in Ashland County, it's all about relationships. I don't know about partnerships and MOUs and all that kind of stuff. I know that people do that, but it's all about relationships. David had talked about he can call the mayor and have, I think I have every one of them on speed. I can call the mayor right now, put him on speakerphone,
Yeah.
right? It's kind of neat to do that. And if you need something done, I meet with the prosecutor, which, by the way, when I say meet with the prosecutor, why? We have a lot of, I don't know if you know this, but sometimes students get in trouble. You guys know that? And sometimes they get like these diversion plans, right? So sometimes the prosecutor will call me and say, hey, he has a sense of humor too. He calls me and says, hey, by the way, we have one of your scholars, So anyway, we work out things. But having that relationship to work with the mental health board, work with the other agency provider, work with the mayor, with all this stuff, everybody's on the same page because we're trying to help the community and the students. So that means a big, big deal. Again, I do have a lot of coffee. So if I'm wired up here, that's because I have a lot of coffee. All right? I talk to a lot of people, but it's well worth it. Well worth it.
And then as much as we do have shared interests, and we have a lot of shared interests from time to time in the community and on campus, we have differences, and we just need to respect that and not allow that to derail those areas where we do have a lot in common. But expect that there's going to be some differences of opinion on a various topic or an issue. That is to be expected. So maybe we'll start with the Healthy Ashland mobile app, if that's okay, Oscar.
Yeah.
This was the community-wide app, which was actually, in terms of development, developed out of the campus-based app. Oscar, I think, wisely wanted to develop something that was specific to the campus, but also would connect into the community. And, a lot of the things on the campus-based app wouldn't apply to the broader community in terms of international students, et cetera. We can get into that. But this is what we had in view. We did a little bit of research on what some of the other apps, and there are a lot of folks doing apps right now in the behavioral space. A lot of them are very, very pricey. I like working with Oscar. He's not so pricey. He's got a team of folks that I don't know what kind of contracts he has, but I don't ask questions. It's just cheaper. But so we wanted an app that was specific to the county. Some of these apps are like national platform apps. They've got some good national numbers. I'm not saying as bad as this, but we wanted to have the county in view. So the basic stuff, stress relief, crisis number. There really was an emphasis on things individuals can do at 2 a.m. by themselves or with a friend or a couple friends and do self-help. So much of what we're hearing is people want the ability, the tools, the information, the skills to do some of these things themselves rather than necessarily having to go somewhere else. And quite frankly, my bias is in the biopsychosocial model. There has been some that have said that the biopsychosocial model as a way of understanding mental health and substance use challenges has really been the bio model for many, many years. There's been such an emphasis on the psychiatric or the biological components of what's going on. I think we have, to some extent, left off some of the psychosocial. So anyway, we wanted things that folks can do. We've got great park systems, exercise, right? There's lots of basic things that have some good research and support behind it that might be useful. But we wanted to know about all the different resources, obviously community resources and activities. I don't know if it's a good thing, but did you hear we just got that DORA?
I know you got DORA. I know.
Everybody know what the designated outdoor refreshment area is? Yeah, Little Ashland's got a DORA. I don't know what's going to happen. They didn't ask my opinion. I wouldn't have given it to them, but I couldn't in my position. But primary health, veteran services, and then a feedback loop. If you're going to do an app, this gets to your point, nothing about us without us. If you're going to do apps or any of these things, make sure you have a place on there for the community or the campus to say, this is dumb, or I really like this. This should change, blah, blah, blah. That feedback is folks expect that.
Oh.
And it's the best. It's the best kind of feedback you're going to get because it's anonymous and they say all kinds of things.
All kinds of. But the other thing about that is, again, it's mental health people, mental health folks, professionals, whatever. We think we know what people want or need. Sort of like when you said ask us to. When we first started off, it was really clinical. It was like suicide lines, all this junk, and then people say, why would I ever use this app? And so since then they made suggestions. So now we have, from weather to outward resources, what games, where they can go to stuff. We have videos. We have white noise generators. We have an 8-ball that they can push. If they can't make a decision, they can push the 8-ball and says, "Go ahead," or whatever. May not say that, but it says sort of things like that.
I know.
But we put in all that stuff because they wanted a lot of distractions, which, by the way, and I'll talk about the apps too, what you can learn from the apps. But there's we have video feeds that they can go to, and this one always drives me sort of crazy. I'm not exactly sure why. There's one video feed that they go to all the time. It has a cat jumping in mashed potatoes, and people will watch that over and over and over, which I don't quite get it. But those are some of the things. There's a lot of stress relievers on the app as well.
So, it's always weird to talk about an app. So we thought we'd at least show you the Ashland Healthy Mind app a little bit here in a second, but and then maybe we can jump into the campus-based app too, Oscar, if that's okay.
Well, we don't have to do the campus. We'll just show one of them. We'll just talk about the thing, I guess.
You want to do that?
Is there a click on one of these things? Can you hit it?
Yep. Well, yeah. Well, let's do the top one because that's the campus one. We haven't talked about the campus one yet. So.
All right.
You want to talk about that one? This is specific to the campus.
Are you going to show the video? Is that what you're trying to do?
Let's show them the video. Yeah, it's hard to talk about an app.
Welcome to Ashland Healthy Mind. Our goal is to offer resources to help you live your life and to help reduce stress. Some of the things that we offer are inspirational quotes, information about counseling services, crisis intervention tools, simple ways to relieve stress, and places to go just have fun. We hope that you'll try out Ashland Healthy Mind today.
Spotlight a couple things, Oscar, on there. The decision-making guide was one.
Yeah.
I didn't know you were going to talk about the mashed potatoes, but yeah. So the you want to see that now, right? There's let me see. I think it's this next one. So the idea of decisions for young people, maybe for all of us, is not an easy process. So I'm faced with a bunch of different possibilities here. How do I go about making a good decision? What do I do in this situation? So Oscar got together. We talked through maybe some ways to help with sentence stems to help folks walk this through either individually or with a friend. So the decision-making guide is as simple as this. You swipe through some of these sentence prompts. You can either answer them silently. There's a bunch of, there's no certain way you have to do this. Friend, family member, counselor, I need to do whatever that thing might be because if I do, and this will, etc. The first thing I will do is, another option is the good part. Others may say, yet, if I think of alternatives. And then it gets down to this now, pause for 2 minutes, practice taking a deep breath in and out before answering last question. Now I'm going to. So it's action oriented, but these are just swipes and prompts, and you might detect a little AI in this because I think this is, honestly, there's so many things now that are similar to this with AI where they do these kinds of sentence prompts to help people maybe get into a different space around an issue. But
and again, these are all prompts. They would read one, or they could write it, they can go to the next one and answer it. But the other reason this is up here today is this is one of the top sort of 5 things that our students use. you would, it always surprised me what they use and what they don't use. But this one here, the decision-making sort of guide, we have a lot of students that use that. It's always in our top 5 in any one year that they will go to that and they will swipe all the way through it. Again, we have I'll talk about the analytics. So we know if they're just going to it or they're bouncing away or they're actually using it. And this is the one that they actually will go through every one of the prompts and use. So
Another one you sometimes talk about is, I don't know if you've ever done this, where you can write a letter to somebody, and then it goes. It's a nice little graphic. You write it what you want to say, you send it, but it doesn't go to anybody. It just goes into space, if you will. But again, that idea of getting maybe things here out for a lot of folks is helpful at any age, to kind of get those things onto paper, look at it, and then.
I forgot about, that's about that's used a lot too, probably our third best used thing. That students can go on there and they can write a letter. Actually, a letter comes up to them and it unfolds. It's all graphic, and then they can type in or text in whatever they want to say. And then after they're done, the letter folds back over, spins around, goes out to the universe, goes across Mars, goes all the way through the things, and then it just blows up and then it goes away. We don't keep anything, it just goes away. But that is used a lot too. People just want to vent, get it out there, and they know it doesn't go anywhere. And they use that one as well.
Yeah. And I know this is one of your favorite sections, talking about how we do analytics. For both, you can talk about either.
Well, just the analytics, just pretty much on the app. There's some things that are kind of, when you get the apps, it's one thing to have it use it, but you get the analytics as far as what are people using it for? Where are they going? Like I told you, the mashed potato thing drives me crazy. I don't understand why people do the mashed potato thing or the decision maker. But there's other things you get from the app. You get, for instance, like how many people in here have Android phones? How many people have Apple?
No. Oh, that's
okay.
A big Apple corner.
You know, we because I do have actually graduate degrees in statistics, so I like to play around with stuff. But there's a difference where people go and when they go there based upon the type of phone they use. I want you to know something. Android people, at least at the university, college age, Android people will use the phone mostly to look up resources and things to do and places to go, typically before 6, maybe you can stretch it sometime to 7 p.m. But most of the time it's all done by 6. Apple? No. Apple, 1 o'clock at night to 3 in the morning. And it's so clear. We've been doing this stuff now for 5 years, analyzing it. Depending on what type of phone because we can break this all down, as far as where they're coming in and all that stuff. Apple users look for different information. Apple users look for different information versus Androids people. That where they go, when they go to it, how long they stay on to it. Clear distinction between the two. I don't know what that means, but I'm telling you what, there's a reason why you buy a certain phone based upon your personality. So, and anyway, I guess what I'm saying to you is the other thing about the results is, like David said, that it tells us where they're going, what they're using, what they're not using, what do we have to change, what do we have to modify, what do we have to go back to the students, because we go always back to the students and say, hey, we're finding people aren't using this one. How should we modify it? What should we do? What should we add on there? So the results tells us a lot as far as, like for instance, stress, right? If we notice all of a sudden everybody's going to stress reduction sort of thing, we know, okay, there's a lot of stress at the university, so we start changing our programming and start changing our workshops. And then all of a sudden you'll see we have these white noise generators on there too. And when they use white noise generators in studying, so we know when all of a sudden that goes up there, we contact our advising, our tutoring program and let them know that people are studying, they're stressed out, if we can offer workshops on studying and anxiety and stress things. So the results that we look at on that app, we use that to drive a lot of the programming at that time at our school for the students. So anyway, that's the results I wanted to talk about.
Again, I don't want to belabor it, but you can download them, Apple Store or Android. So I know we're working on the Apple. Apple just had they're tough to work with apps. I don't know if any of you work with Apple, but Oscar's trying to get a few little things to them to make sure we can get the app compatible with their newest requirements. But
Apple, I really don't like Apple. But Apple decided, just real quick, with the platforms of Nuppy, you can always download them, and you can download the Android app now if you want to go. You can download any one of those apps. Apple, if you have it, you can use it. But the new Apple platform, Apple said that if you're not a recognized medical provider or hospital with an FOC number, with all the different hospital codes, I'm not allowed to, they consider my information fake. So they won't downloaded. So now we're using everything at the mental health board's information and trying to get it back up using that. So that's my problem with Apple right now.
Ah.
But the apps are good. There's some stuff you can do with it.
Yep. So, and again, my understanding is all the slides and all this is available to you through, I think through EADS. So hopefully you'll be able to download those when you have.
Oh, wait, one other thing to remind me about but just real quick about the apps. Again, I'm dealing with the student population, and I said this one because when I left, this was a big issue for us. One of the options students have on there is we have a whole section for studying abroad. Tells them how to study abroad, what to do, what happens if you lose your passport, all this sort of stuff. They also can contact us, no matter where they're at on the app. So this last week, I've got to sort of interview with people in Italy, all right? And before that was in Germany. And it's really helped out both the chaperones, the faculty members, and the students having this app, because before they go, they all download our app, and they know just in case they can use this app to contact us. And that was one of the hidden sort of things we didn't build in the beginning. We never thought about that. And then just because of students and people going on the trips, we built that in. But that has been another sort of godsend, because if you're in another country and all of a sudden something happens, and believe me, it happens, it's nice to be able to contact us.
Mm-hmm. So only a couple slides left, and we will have time for questions. But we wanted to get to what we're seeing in terms of future partnerships, future things that we are already doing together, we might do more of together. And again, as I say, as each new class comes in, each new year, I think Oscar learns more and more about those emerging or changing needs, and we need to be ready as a system to adjust. Again, I don't mean to trigger anybody with any of these things. These are just things that Oscar and I have been seeing. We're not unique, I think, in noticing some of these things, but I know not everybody's on board with maybe every one of these concepts. Virtual counseling and mental health services are here to stay. So my comment on this, I was always, I don't know where you were at when, the pandemic and the shutdown really took place, but, I was up quite a few nights. I tend to be a worrier anyhow. Oscar analyzes that. Don't listen to him. I tend to worry about a lot of things. That's my job, to worry about a lot of things. So I was thinking before the shutdown, how does a community behavioral health system in Ashland County that's doing literally no telehealth, literally no, because again, the restrictions and requirements to provide telehealth before the pandemic were very onerous. That's why people didn't do it, okay? But then the government opened everything up, because they understood, given the times, that they had to do that. So, but my worry was still there. How are we going to pivot so quickly such that clients aren't impacted negatively about going from in-person, all in-person essentially, to no in-person, everybody on virtual or the telehealth? And, I'm just I'm shocked how quickly a little county like Ashland, within 2 weeks, everybody was up. They were seeing people. They were delivering devices if they needed to. They were working with folks that are having connectivity issues. And our little system was able to flip over within a few weeks. I know there were different issues when it came to like school systems and other things, but in our little system, they did that. And I was very proud of them. But again, it wasn't the best fit for everybody. So as soon as there was an opportunity for people to start to come back to the office, some people could not wait. Some of our practitioners could not wait to go back to the way things were. Some of the clients that wanted things to go back, but then we had a significant amount that said, no, this is really cool. I like this. And we've never had more counselors that have left community behavioral health to go stand up either private practices or group practices where they're doing a fair amount of tele. And they're working from home and they're picking how many hours. There's just so much flexibility. The downside is the community behavioral health system, the traditional, what I call legacy community behavioral health system, is losing all these wonderful, talented people, and that workforce shortage that we're all experiencing, it's really hitting us hard. Oscar and I were out with some of his younger graduate students, and I'm always interested in what the younger people are interested, because I think young people in college right now look at the community behavioral health system and they don't see a lot of attractiveness to it, and we've got to work on that. I know the State Department of Mental Health and Addiction Services is committed to doing that. I just hope we can do it quickly. So My bias is that for a large amount of people, virtual counseling is just here to stay. But I get it. Not everybody likes it, and there's still going to be a place for those legacy bricks and mortar buildings.
Yeah, just real quick, as far as virtual counseling, I mean, I use it obviously a lot now. I started as a therapist in 1976. And if someone would have told me in 1976 we could talk to people on the TV, I would have. First of all, I said it will never be able to be done. And then I would have said, why would I ever do that? I have to be in the same room. Now I completely understand what it's in the benefits of it. But one of the benefits I'll just say at a university, and this I'd never anticipated this, but when you're doing virtual counseling, a lot of this was taking place in the client's home, the student's home, because we were remote. I got to speak with parents. I got to speak with grandparents. I had these family systems sessions on the internet that I would have never thought would have ever happened. And same thing with psychiatric hospitalizations. I've had so many discharge meetings now that include the therapist, the social worker, the psychiatrist, the mother, the father, the client, and then me on the other end. That would have never happened 5 years ago that could have never happened. So I know a lot of people are fighting it, but when you look at some of the benefits it brings, there's going to be a part for that in the future, no doubt about it.
I know we're short on time, but I think this is the first time I've been to Columbus in 4 years, I was saying, just because I used to come down 2-3 times a month, but just with all the changings, I mean, think about this. There's 50 boards that represent all 88 counties. We would descend on Columbus for meetings on a regular basis. How inefficient is that? If all we're trying to do is exchange information from one party to another. I mean, it's all, in some ways we've really gotten more efficient. And I don't want to. I know I want to leave time for the drop-in clinic times because this is another emerging fun thing. So less brick and mortar legacy facilities. I just think there's going to be less need for facilities. You're seeing this in other industries as well. And we'll come back to AI because that always pushes buttons. But I wanted to talk about less structured scheduling. Oscar started something with his drop-in clinic times. I'm trying, again, some of these things start in the community and then they maybe can work into the campus. Sometimes things start in the campus, they work out. So it goes both ways. And this was one that Oscar came up with on campus that we're trying to push out to some extent into the community. But if you could set this up a little, because I just thought this was an intriguing idea of having kind of unstructured open time that people can just literally drop in a virtual way.
Yeah, and again, the less structured drop-in times. that drop-in times was created for a certain population we see at the university. At Ashland University, we have the largest prison education program in America. We have 6,000 enrolled students. But what happens is after incarceration, they get out, and so we have a program called previously incarcerated students. So they could be in whatever, Michigan and Arizona, they could be all across the country. And of course, my license does not extend past Ohio, right? So, but they needed services too, not mental health services, but transitional services. So we started the program, it's transitional life coaching is what we call it. That way I can go across lines, and it's not clinical. It's just helping people acclimate to the outside world, get on there. But what I did was we started off on Fridays, and I said from 2 to 4, anybody in that program could just come online. And again, like a lot of platforms, you have a waiting room. They could come in and all that stuff. And everybody's told, I could see you for 5 minutes, or I could see you for 50 minutes or 2 hours. It all depends if somebody else comes on there afterwards. I have to let you go. Which, by the way, has been received very well. If I tell somebody, hey, there's somebody waiting, they say, great, I'll see you next week. Or I'll see you, can I come back in 30 minutes? I'll come back in 30 minutes. But that drop-in time has saved, well, this is I'm speaking specifically for the previously incarcerated. That has really helped, because recidivism in the prison program is pretty high. They come back into the system. And luckily, and knock on wood and all that stuff, of the 24 or so that we've been dealing with, that has not happened. And I think a lot of it has to do with we've given them contacts that they normally would never have ever have had. So, and they could drop in at will. For our traditional students, they also have a drop-in time on another day. So, and that has saved us crisis, and they know that they can stop in at any time. So we have this open time 2 days a week on my schedule. My other therapists have 2 days a week also. We stagger the days so they can walk in. So at any one time, they don't have to wait for an appointment. They can come in there. Everybody knows the rules, and we have had nobody abuse the rules. Everybody follows them, whether we see them for 2 minutes or 20 minutes. But just having, I don't even know at this point how many sort of crises we've averted just because we've given them ability to walk in. And they walk in online, virtual. So they walk in, we see them, we talk to them, we see what's going on there. Anyway, I don't know how that fits in the future with public mental health and billing, because we don't bill at the university. And I know you have to bill insurance. So, but anyway, that walk-in time has saved, it has been a godsend for a lot of reasons.
Yeah, the modification we want to make at the community is, and you might have connected the dots already. I talked to you about workforce, right? There are a lot of counties have wait. I mean, anybody know about agencies with wait lists and wait times to get in for certain services? So I see it as a kind of wait list management, if you were, so folks can still get some kinds of contacts why they might be waiting a week or more, depending on the service that they might get. That's at least one way I know our agencies can use this, because folks often, especially certain generations, they're not going to wait around until they get called for the wait list. I think if we don't connect with the folks that have reached out, and if we don't help them fairly quickly, I think we're going to lose them. I know we're going to lose them. So I really see a future for this more of less structured. We can get you in. It's not exactly where you may end up, but what was that? Single session therapy. Asha Talman years and years ago wrote a book, about really you only need one session to really be effective. So more often than not, folks, it is still the most common number of sessions people go for is one. More often than not, if you get basic kind of affirmations, information about your situation, for a lot of folks, that's all you need. So believe it or not, this really could be a tool for some other issues. Maybe the person doesn't even need to go beyond that with just one of these drop-ins. Less need for licensed or professional helpers. This is another outgrowth of our workforce issue, but it's also an outgrowth of, I think, what people want. Not everybody needs or feels that they need to talk to a psychologist, psychiatrist, or an independently licensed counselor or social worker. There's been a big push in Ohio. I'm sure you've read about it, for peers. There's so much emphasis on peers. And partly that's because I think there's a lot of support in the literature for the effectiveness of peer, but quite frankly, the other reason is we don't have enough professionals. We don't have enough counselors and social workers going in. But when you talk to individuals, because we have a peer center, Pathways in Ashland County, and they see a place for the professionals, but I'll tell you, they like to talk to folks that have been there and done that. They like to talk to people that are in recovery. It's not that the professionals don't have something valuable to add to that conversation, but I think, peers on campus might look a little different than peers in the community, but I think you can see where there can be some crossover there. So I see this ongoing, because I just don't see, unless something changes radically with how we make our system more attractive, I think there's going to be more and more, as you heard Oscar talk about, coaches and training, people not using that counseling or that clinical language to support people and to help people. Again, getting away from the bio, because if you're doing bio, you got to be a psychiatrist, psychologist, But if your approach to helping people that are experiencing human distress isn't necessarily a biological approach, maybe you don't need all those degrees, okay? And maybe you don't have to, okay? Real quick, I know we gotta make sure we get out of here in time. The AI council. You want to talk about AI or podcasts? Maybe.
Well, just real quick, the AI, just to let everybody know, I don't know if you've seen these yet, but how much the military is using AI, virtual counseling, and robot counseling. I don't know what to call it. What's the
avatars or
avatar? I don't know if you've seen some of the military programs. They have 11 military programs, but any military person can use it across the, because they're overseas or whatever, and they can actually talk to an avatar, sort of a chat bot, and it will do artificial intelligence sort of counseling with it's robotic. But they have 11 programs for depression, anxiety, general, being away from, they have 11 programs. So if you haven't seen those, you should check them out, because they're absolutely amazing. And the other thing that I was introduced last year, I didn't realize that they were using, what are those headsets?
Your VR sets.
Yeah, the VR sets. The VR now is being used in therapy for different reasons. And I was talking to some therapists on the West Coast, and they use it. They put on their headset, they join with their client, and they will walk through a jungle and virtually and do their session using the headset, which is amazing to me.
I know you know some of these stories, but we've got several senior citizens care centers in Ashland County, and for someone was an older person that was fairly immobile experiencing a lot of depression, who her dream was always to go to Paris. Well, guess what? We got the VR set on her and she went to Paris. And for the first time in many, many, many years, the staff talked about how positive, and she just lit up and she couldn't believe it. So I mean, there really are some very creative uses for the VR sets. And I know this is the part of the talk people get a little freaky about AI, because I understand things, cue Darth Vader, but things can go really bad, with AI. But they're again, when the workforce issues, the 24/7 availability, you start thinking how this might be able to fit. The one I like to talk about, Ashley and I always joke, is with what do we use? Outlook 365. Right? So, right, have you noticed Outlook 365? Somebody writes you an email and you're getting ready to respond, but guess what? Hey, you don't have to respond, because it usually pre-generates about 3 or 4 responses for you. And sometimes they're really clever. I don't need, saves me at least a half a second. So anyway, AI, you're always, if you're on a lot of the websites, you're already using, there's a chat box, there's a chat bot that you're probably talking to. So it is a little scary, but there might be a place for it. So I wouldn't just rule it out right off the bat. And then podcasts and other technologies. Another thing that I think came to some extent from the campus to the community, and a little bit vice versa, is how do we talked about PSAs, so maybe this is a modification. Folks like to listen to podcasts. I like to listen to podcasts. They are very, very, I prefer the audio. I don't care about the video as much, because I'm always doing something else when I'm listening to my podcast. So we're trying to get information about the resources, about mental health, about substance use. And so Ashley and I will very soon, I'm setting up the equipment, as we've done some podcasts at a radio station in Mansfield, and the community really seems to like those. We're going to start doing those in-house just because of finances. It'll be cheaper. But I would challenge you, if you're not thinking that way about how to get the information out to maybe different ages or younger folks, they tend to like some of these newer platforms. And again, this information has to be conveyed in a way that is accessible, easy to understand, and a lot of folks like that medium. And again, that was another thing. We just, Ashley and I were just interviewed by the campus radio station. So that's another example. Keep those communications between them and the community.
Yeah, and the podcast came up real quick because out of developing the app. When we were asking students what should go on there, he said, how would you help? What do you think should be on there? And all of a sudden, we said, write down ideas. And they were writing down one podcast after another. All these podcasters, I'm thinking, I had no idea podcasts were so popular, and certain people kept coming up and up. But anyway, the podcasts, students listen to them, and I'm sure adults beyond the student age do.
I know you told me that you selected some of these graphics with intent. Do you want to spotlight any of those?
Intent? Well, no, pretty much the robo-counseling of that thing, because I am fascinated by what they can do. When I was watching the military, and I got to play around with one of them, and I pretend they say, you could go on there, and I say, I'm depressed. And I said, well, tell me about your depression. I said, well, I'm sad because da, 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 da. It prompted me all the way through there. I mean, I knew it was a robot sort of thing, but you know what? It engaged me in a conversation, and it remembers everything you said previously. And the AI,
unlike therapists.
And the AI will go back and say,
okay.
because it knows your name, because you say your name, it says, Oscar, you said previously that da 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 da. I said, yes, I did, but I was at it. They said, could you clarify more? So I don't know if you've seen these AI programs now, but they're getting very sophisticated. And I can see a time where you're going to have online AI counselors where you're just going to talk to a virtual counselor.
All right. Anything else on here?
That's all for me.
All right, and I'll end, of course, as we started with partnerships. So we didn't get a chance, obviously, to talk to everybody, but the few folks we did talk with, I know a lot of you already have great partnerships that you've established between the community and the campus. But that's the key. If this is work, and that's why we were just so grateful to come and to present again. We've done a few of these, and we just feel passionately that both the campus and the community benefit by these partnerships. They can be hard work, but I think they are very well worth it. So with that, I know we've got some time, a few minutes at least, for some questions for folks. Anybody? Yes, ma'am. Yes.
A lot of the west side of the state is using, I think it's called Local Help Now app.
Yep.
So did you create this app, or is this something like another organization? Because that Local Help Now, I think, is out of an organization at a Dayton.
Yeah, yeah, the Get Help Now people, I think, were behind that. That was the pricey one. I looked into that one, and I
Yeah,
said,
we'll
we
look
can't. Yeah, so I showed that to Oscar. I said, okay, this is what this costs. Could you give us the Pinto version? If you don't know what a Pinto is, that was an old budget car. So we got a Pinto version, but it's still good. But yes, it's very similar. But the Get Help Now and some of the variation, they're great apps. It's just oftentimes you want to make sure they're localized.
Mhm.
That's what I've seen. Sometimes there's too national. The feedback we've received is make this local, because like you saw in there, they want to know about our canoe livery. They want to know what's going on with the chamber events. They want to know what's going on with Dora. They want make sure that there is local events on there too. But yes, that's a good app.
And are your students involved with creating the app?
Oh, no, yeah. Well, you saw the young lady who introduced it. She was part of one of the many groups that were designing the information that they specifically wanted. But again, about the Pinto version, so you know what the Pinto version is. When you talked about using students, all right? I told you one of my graduate degrees is in statistics and evaluation. So I have a lot of stats students come in, a lot of computer science that I mentor and do a lot of projects for. And they all want to work on my project because we do a lot of strange things. But the reason I could do a Pinto version is I get my interns from not just our school, I get them from all over the place to do these projects, to develop the Pinto apps because they get to learn about it. I get to create something for the community, something for the university. So it's a win-win, and they get a lot of good experience. They learn a lot of different things. But the reason we can do that is because I have tech interns, computer science interns, and math interns, and we can put these things together and custom design them. But that's how. Otherwise, and if you price these apps, you're right, they're $100,000 is not. It's $60,000 update them, and believe me, you pay.
That's why. Yes.
Yeah. But when you use the resources you have, and everybody's on the same page as far as partnerships and wanting to learn, you could do that for a tenth of the cost of what it costs.
Yeah. Oh. She wants to get to your military apps.
Yeah, how do you get on the military app?
Keith, didn't you present on this one time? Didn't you have a forum on this for the veterans at your place, school? I've only seen it at military conferences when they were showing what they were doing for soldiers. I thought I was at your school when at Tri-C when they did that. No. Anyway, I was at different workshops where the military has shown what they're using with their soldiers. So I don't know if you can get it online or look at the veterans and see if it's available, or veteran services, but I do know that I saw it at workshops where they were showing what they were using.
I have a question. I know one of the kind of new practices of policing, at least in our community, is to tag along mental health supports with, police officers. So just in case the person is actually experiencing a mental health crisis, they're not just showing up and being re-traumatized by having police come in or whatever. And I know that all the time, as I think someone said, like, our students get in trouble, and sometimes it's off campus. So I'm kind of wondering, like, is there partnership going on right now about how mental health is accompanying criminal justice stuff?
Yeah, I can tell you, we had that conversation with our law enforcement. They did not want that. I know that varies by community. And I took that response better because I know most of the people that are doing it, and we don't do CIT proper. We do our own version. We do robust training with our law enforcement around principles we call 3 legs of the stool, which is really, again, that psychosocial approach to treating emotional distress. So a lot of our officers have had that. We've had very good interactions, even when there could be a mental health component. So I took that response better than if we were having a lot of instances of, again, people being tased, people being cuffed when they didn't need to be, et cetera, et cetera. So, but yes, I think law enforcement needs to be on side for something like that, and ours was not, but I thought the rationale was okay with that. But I think all law enforcement should have some kind of training to make them more sensitive, increase education, and the biggest thing we've been doing with our officers, I think maybe my old boss used to say that the knife and the oyster with law enforcement is typically self-care and post-traumatic stress trainings with our law. They get that, especially the younger officers. They get that they need their own tools and skills to help keep themselves safe. And then from there, once they start to appreciate how they're being traumatized by the work they're doing, they better appreciate the people they're working with that have also been So that's one angle that we've used to get, I think, more of a sensitivity. But good question.
Yeah, and on that too, as far as our director of security, who's on all our suicide tabletops and all that stuff, and I told you the police department are also involved with that with us too. If we have somebody, because again we get a lot of wraparound plans, we know a lot of people are being discharged, so we know their history. If there's a crisis on campus and there's some sort of mental health history, I will immediately let our security director know, because our security director has a direct relationship with the police department. So I tell him, explain the situation. He tells the police department, and the Ashland police, when they do come up, they're already aware and they treat it completely different because they know the history. But again, that gets back to relationships. If I didn't have a good relationship with our security director and our security director didn't have a good relationship with the police captain, it wouldn't have happened.
Yeah, one of the campus community partnerships that I saw was improving sexual assault response of officers, because when they show up, they're kind of reifying stereotypes and like, oh, look at the way you're dressed.
Right.
Say these really insensitive comments. A community-based learning project was to create a better screening tool and help create training for these officers to do that kind of stuff. Anyway, it just kind of raised my awareness of like, wow, how could we be doing this stuff better with law enforcement?
Yep, good observation. I think we had one more question. No? I know we're a little over. I need to go ahead. No.
Sorry, I missed some of your talk, so you might have already said this.
Okay.
But in addition to the extensive training your officers go through in order to handle mental health issues, we talked a lot about stigma previously and how kind of embedded it can be in the fabric. And we also know that, mental health calls, if it's a person of color, they're more likely to end poorly, either in death or, tasing and things like that. What do you do for your officers in that? Like, do you do extensive training on those?
We do, but because our diversity is more Appalachian, it's where I think the census we were around, in terms of race, we were around 98 point something. So that hasn't been the primary driver of the diversity that we've seen in the county. So I wouldn't say we've done as much as other counties around. Mansfield, for example, is right to our kind of southwest, where they've done more of that. They do have some robust CIT training. So because they do a better job, we send our officers over there, and the folks that run that CIT, that's where the folks really want that. We send them there, or to Wayne Holmes County. That's another board that's on the other side of us, and they have more of established CIT. So it's kind of an a la carte when it comes to some of those issues, because for our county, it is what it is. I mean, the kinds of things we're dealing with, it's more likely the Appalachian and or the rural or the very, very poor person in that culture that they're dealing with and maybe not understanding.
Yeah, and just to follow up with that, at the university, a lot of our minority students are on the athletics programs.
Yeah.
For instance, and so every year, just so you know, every year the football team, well, I should say all the athletic, but the football team in particular has with all the team there, has a Title IX sexual assault. It's a big workshop, which includes the local police department. And so they're involved with that presentation and getting to know people, and they're more sensitive to what's going on. So we do include that, but that's within the athletic program itself.
Good question. All right, thank you. Sorry, we're in a little over.